Welcome back to the last pelvic and urinary healing podcast you'll ever need. Make sure and begin at episode 1 if you haven't heard it yet. This series goes in order. So, in this episode, we're going to talk about what the brain is doing. Why would it be creating pain or dysfunction? I thought we were cool, brain. Like, why are you doing that to me? So, we're going to better understand the neuroscience and the entire build up to what has created your current pelvic and urinary issues. Your thoughts and emotions affect your body's physiology. So, that's important to recognize. What I found to be the best explanation and presentation for what is taking place is what's called mind-body syndrome. Don't get too attached to the name, though. I like to use mind-body syndrome. You could use TMS, which is tension myositis syndrome. Psychophysiologic, you can say neural circuit pain, neural circuit dysfunction, neuroplastic pain, psychogenic, psychosomatic. They pretty much all mean the same thing. The mind is affecting the body. The mind affects the body. It's just that there's not a structural, obvious pathology. So if you fall down off of a ladder 8 feet and you land on your tailbone and you injure your tailbone, I mean, there's pathology there. You're going to have some trauma. You're going to have some symptoms that will arise from that acute incident. If you have an infectious disease, there will be something that arises. Now, if you don't have something that's structurally present, the mind is ultimately at play. And we're going to get into what's really taking place here. I also like leaning into mind-body syndrome because the name is very clear. And Dr. Howard Schubiner and others are doing great work giving you the neuroscience, giving you research studies so you can actually get into this body of work if you need more information, right? There's a lot of it out there in the TMS, psychophysiologic disorders community, etc. So what is mind-body syndrome? In a nutshell, mind-body syndrome occurs when the brain receives excessive danger signals, turning on the alarm response, creating pain or dysfunction. This physical dysfunction is designed to protect you from the threats that are perceived by the brain and alert you that there is a current imbalance in your mind-body system. Now, I mentioned this in episode 1, but I want to say it again. Neural circuit pain, neural circuit dysfunction, it creates real pain, real sensations, and the dysfunction, just as does structurally created pain. The brain is always in charge. So we talked about that in episode 1. I have clients sometimes, they'll be talking to me on their first call or in an inquiry or something. They're like, I don't know, like I must have something wrong with my body. This is really bad. It hurts. It's like level 9 pain. I'm like, no, your brain can create level 9 pain too. It absolutely is creating all pain. But why is it creating the pain is what we need to look at. So it's not belittling what you're experiencing at all. It's not all in your head. This is real. So if a physician says that this has to be all in your head, no, it's in your brain. But why is your brain creating it ultimately? And why is that sensation being felt? And there is a reason why, right? So this is real. Don't discount that your brain can create such extreme symptoms. Now, what's really interesting is that many conditions are actually mind-body syndrome or psychogenic in nature. Being misdiagnosed, such as migraines or chronic headaches, neck pain, back pain, IBS, other digestive issues, fibromyalgia, TMJ, repetitive stress injury, insomnia, anxiety, depression, OCD, chronic hives, tinnitus, many other conditions. You can find a list of them on mind-body syndrome or TMS websites. And if you look inside of yourself, you're like, oh, wow, not only do I have pelvic pain, but I have low back pain sometimes. Or not only am I dealing with urinary issues, I also have had IBS since I was 19 or something like this, right? You can find parallels. That's not always the case, but many times it is because they're actually just different manifestations of mind-body syndrome in different parts of the body. And why does it show up in different parts of the body? And we'll talk about that even as well, because it's interesting and it's useful. Also, I want to point this out because a lot of people talk about anxiety and they talk about stress. And they're like, oh, I have pelvic floor issues or I have this. It's because of anxiety. Anxiety is not the root cause of your pelvic or urinary issues. Anxiety itself is a symptom. Anxiety is physiologic. You feel it in the body, and there is a mental component that's attached to it, right? You have both things going on at the same time. But if there is not an underlying imbalance, a repressed emotion, or psychological conflict, or something else, like we're going to talk about some of the root cause possibilities, you don't have anxiety. Anxiety is a symptom. It's actually a manifestation as well, as is depression. Stress itself is not a root cause. Everyone has stressors. There are people who have lots of stressors who are totally fine, that don't have pelvic or urinary issues. How stress prone you are or how reactive you are is a deciding factor. Why are you more stress prone? Why are you more reactive? Why is there fear that gets thrown into the situation? Right? We're going to talk about that, how that was developed. So let's bring it back. Okay. We had that example of Jake in episode 1. And in the time leading up to his symptoms, remember, 2 months prior, he went through an unexpected breakup. He had more work. He had more stress at work than normal, financial issues, right? Those were things that were building up and compounding. But even then, that was recent. That was right before it happened. Let's go all the way back, though. Let's go back and really look at the timeline of how this could have come about. And I'm not going to give just Jake's situation specifically, but let's talk about first childhood. So everyone has a childhood. We were all babies and kids once, right? Childhood stress primes the brain to react with fear to certain situations and triggers or to activate other emotions. Now, you might be like, no, man, I had a great childhood. My parents, they were loving and I had everything I needed and I had a great childhood. That's amazing. I'm really glad you did. And some people had really terribly challenging childhoods, but everyone experiences stress of some sort, right? There can be trauma. There can be little t or big T trauma. So you might be thinking, I didn't have anything crazy happen, right? And you might be listening, you're like, yeah, I mean, my dad was an alcoholic or I got abused and there was some really big trauma. Absolutely. So we're going to talk about both. It's all relevant, right? So little t trauma, we could say bullying. I mean, that could even turn into big T trauma. It could be like smaller bullying, though, just from siblings or at school that still really affects you. Parents with high expectations who are expecting you to hit a certain standard all the time. Overly critical teachers or caretakers. Absentee parents. Feeling inadequate or feeling different from others in some way. And some big T trauma, physical, emotional, or sexual abuse, violence, tragedy, loss, accidents, abandonment, unexpected changes. By the way, these can lead to mind body syndrome symptoms even in childhood. When a child is experiencing a mind body syndrome manifestation, we look at the parents, we look at the environment, we look at what's happening on a daily basis. Is there an energy of pressure? Is there an energy of abuse, of love and joy and compassion? Like, what are we seeing here? Okay, it might not seem extreme, but there can still be something internally created by the child that is then enhanced by the environment. So let's talk about your personality. And you might be like, yeah, I'm so hardworking and I'm so responsible and I take care of everyone. And these are honestly, I'm not trying to say these are bad things. It's not bad to have a good work ethic or have grit. It's not bad to be loving and compassionate and wanting to serve and help others. But typically, these personality tendencies that are more imbalanced, that are stress inducing, were created as coping mechanisms. They're not really your true essence self personality. So for example, being hyper responsible as your single mom had too much to handle. So you're like, oh, I got to help. I got to take care of everything else. So you learned that. You learned that you need to be the one that can take care of everyone no matter what. Keeping your parents happy or at peace. They're fighting. There isn't a lot of joy in the household. So you're like the one who brings everyone together. You're the glue. And maybe you've developed this pressure and this pattern that puts a lot of pressure on you the rest of your life. I mean, if you learned that when you were younger. Responsibility for siblings. Maybe you're the oldest or one of the older siblings and you felt really responsible. You had to take care of everyone. Becoming a perfectionist in order to please your parents or teachers or coaches and win their love. Because if you made mistakes, you weren't receiving that same sort of love and admiration. Fear of confrontation after getting beat or getting in trouble for speaking up. So you learn to step away. No, I'm not going to speak up. I'm afraid of confronting others. Maybe you were emotionally disconnected because intellectual pursuits and academic achievements were celebrated, but feeling your emotions were not. Putting pressure on yourself to be successful due to not having money, to not feeling any freedom as a kid. And you're like, no, I want to have something. There are things that you could have learned as personality tendencies or traits. These were coping mechanisms. They helped you survive. They helped you to survive in your childhood, your adolescence, and to make it through. And some of these things can be discarded now, right? You don't need them any longer. But if you've been living a certain way your entire life, and are these stress inducing to be hyper responsible, to always think that nothing can hit the ground, you're in charge of everything. I'll make sure everyone's happy. I'm a people pleaser. I don't want anyone to have a difficult time. I'll make sure I'll lose as long as everyone else wins. Do these things create a pressure? Of course they do. Not feeling your emotions, being a perfectionist, putting pressure on yourself constantly to do better and better and better and better. Think about the way the body responds to something like that. Situations in your life as an adult can trigger the same reactive conditioned patterns from earlier in your life, turning on the same danger signal in the brain or activating the same type of emotional pattern. For example, your boss criticizes and cuts you down at work like your father used to, activating the same emotion of inadequacy and failure. Your girlfriend of 10 years breaks up with you, and you are feeling like when your parents got a divorce and your mother left. So there is something that was called, this is priming. Priming happens earlier in life, and then a trigger can hit. It can hit because there is a pattern that wasn't fully released yet. And we'll talk about that, releasing this emotion. Life stressors can become too much, and a particular incident can become the one that breaks the camel's back, the one that really all the bathwater comes out of the tub. So oftentimes when people talk about their story of when they started having pelvic floor dysfunction or some of these other issues, they'll be like, yeah, I mean, work was really stressful, or someone was sick, or COVID was going on, etc. And they'll notice there were a lot more stressors that came up. But even then, it's not just those stressors, right? There's typically been a buildup, a priming, and a triggering. But that can really put you over the edge. And then you'll have an incident like, oh, that's why it all started because I rode my bike for 10 miles. I usually only ride my bike for 5 miles. Or I had sex twice in one day. I usually don't. Or like what? All these things. Your brain is looking for a mechanical pathology. So let's go back on track though. The nervous system is sensitized, right? We have all these life stressors. The nervous system is sensitized to so many danger signals flooding in that the brain creates pain or physical body dysfunction as a protective mechanism. It's like it's too much. It's too much. Something's got to give. You're trying to do too many things. You need to listen to what's being felt internally. It's like when you work yourself to death. This has happened to me before. Multiple times. Like you work so hard, you're overworking yourself, and then you're like, finally a vacation. You go on vacation, and then you're sick the whole time. You have a virus or something, and you're sick for like 3 or 4 days straight while everyone is having fun around you because your body's forcing you to rest and recuperate. It's like finally We get a chance to have our recuperation, our self-healing to take place. And this is like an extreme, this mind body syndrome thing is like an extreme version of that in some ways. The onset of symptoms usually leads to fear. Did that happen in your case? Probably, which fuels the cycle even more, leading to these neural circuits, whether they're the pelvic pain or the urinary urgency or back pain, as becoming learned. So maybe there even was an initiating incident where you urinated more times than normal in one day, or you hurt your pelvic floor in some way, or there was an incident. Maybe there wasn't, though. There doesn't have to be, by the way. But these neural circuits can become learned, and they are more easily activated and triggered by previously safe activities due to the state of the mind body system. So, again, the mind body system and the nervous system, because it's upregulated, there's a higher sensitivity to things that were previously just safe, normal things can now trigger you. Really, what's happening is your body whispers to you and finally has to scream if you're not listening to the earlier emotional signals, and physical imbalances are created. The brain creates pelvic pain or urinary frequency due to this extended period of fight or flight. The brain learns the pain or bodily dysfunction as the same neural circuits are repeatedly activated and strengthened. It's like walking down the same path through a cornfield every day. After a few weeks, after a few months, you're going to have a rut in the ground. Water can run there more easily, right? Because you keep going down the same pathway. You're not consciously doing it, but subconsciously it's taking place. As a protector, your brain creates symptoms to divert your attention away from difficult emotions that you don't want to feel. Your brain is protecting you because there's something deep down that is more painful. As a messenger, your brain is creating symptoms to let you know that something needs to change. Now, it's important that you get checked out by a doctor in case there's a structural element at play. That's always advised and important because there might be something going on that needs some biomedical intervention. With the men that I work with, a very, very small percentage of them have anything structural found. But sometimes that is there, and it's important to know about that. But do know that normal abnormalities can be found. So if you take 100 people and you do an MRI of their back, you're going to find that a percentage of them have herniated discs or bulging, and they don't have any pain. They're totally fine because it's normal wear and tear, degradation of the body. Whenever your skin begins to wrinkle or your hair is turning gray, it doesn't cause pain. If you image someone's body, you're going to find imperfections because that happens as we age and we change over time. That doesn't mean it has to create the dysfunction or the pain that you're feeling. It may have a relevance, but it may not. So, not to become a vomit, a victim of modern imaging technology. There are a lot of beautiful aspects of modern imaging technology as well, but have a greater level of awareness. Also, with the doctor that you're working with, your physicians, et cetera, keep in mind that most doctors were not taught about mind body syndrome or psychophysiologic disorders as they were brought up in this allopathic model of medicine. Allopathic medicine is amazing for acute injuries, accidents, and pathogens, but it divides the mind body emotional complex into many areas, which can lead to a misdiagnosis and a treatment approach that's very divisive. So, by all means, work with your physician because they can help to look for those structural aspects, but your physician may or may not be aware of some of these other aspects of health. And by all means, if you have the ability to talk about it, that's awesome. It's important to know that injuries heal and scars don't cause pain because you might be like, no, I had this injury 3 years ago. It keeps flaring up. It keeps flaring. It keeps coming out. It keeps coming back. Injuries actually heal. But your brain can reactivate those same neural circuits when under stress to sound the alarm. Those were learned. Those were learned from a prior injury. And there's a cognitive bias to utilize that part of your body because it will make sense ultimately. It's like, oh, yeah, that happened. So it will make sense. The subconscious can hide the repressed emotions, the conflicts, the other things that are ultimately creating the danger signals and setting them up to even activate the neural circuitry. It can utilize a past injury because you will think that, oh, that's what it is. But all injuries actually heal. Definitely watch out for the symptom imperative phenomenon as taught by Dr. John Sarno, one of the pioneers in the psychophysiologic field, because you might heal one symptom at the surface level and then it shows up elsewhere. This is so crazy. I'll actually look at other approaches and programs sometimes in the way that people are looking at healing pelvic floor dysfunction and urinary issues. And there are reviews talking about using these mechanical methods. I stretched and I did this particular approach and I did it just right for 2 years straight. You've got to be disciplined and it works and it works. Now, if I could interview, and I might actually at some point, I'm curious about how many are experiencing the symptom in other parts of the body. Because in an earlier version, when we first released the Overcome program, Dr. Brianne Grogan and I, whenever we created the original version, it had less of a focus on the mind body area. It was there some, but people were really focused on the mechanical side. And I would find that people would get better, like, oh my gosh, I'm feeling a lot better. So grateful. And I had some follow ups, and I would notice that sometimes it would move to another part of the body. That doesn't always happen, but I just want to point it out that if you don't really go to the root cause and you just do mechanical symptom level, surface level therapies, you're working at the level of effect, not at the level of cause. Therefore, that which created it can be reactivated. It might not for a while. Someone's like, I'm good. But then a lot of stressors arise. Then life hits you. Then there's another trigger 6 months later, a year, 5 years later, etc. What I'm pointing out here is that in this podcast, in our approach, by going to the root cause, we're removing that chronicity. We're actually allowing ourselves to not have chronic issues created. We are able to use them as acute messengers instead and know that they can move to different parts of the body. You can go from pelvic pain to now IBS to now headaches, or it could be in one area of the body. It could be it started in my perineum, now I feel it in my testicle, now I feel burning in my urethra instead, etc. It's symptom imperative. You might be wondering, why did my symptoms show up in this part of my body? If mind-body syndrome can manifest as a headache, or digestive issues, or back pain, or pelvic floor issues, urinary issues, sexual dysfunction, why in this part of my body? This is very fascinating, and it's actually useful because in many cases, it's helpful in the investigative arena. It's helpful on the investigative path of, okay, I can see even more so why I'm dealing with what I'm dealing with. Let me go over some different possibilities because it's different for each person. One is importance. If you care more about this part of your body, it could call your attention as a messenger and make you change more quickly, make you actually listen, right? So, sexual or pelvic floor issues versus an ankle injury or your elbow. I mean, I know a lot of guys that will roll their ankle or get a knee injury and it heals up, they're back in business. But I mean, something related to their manhood or sexuality, right, hits you harder and you really, really notice it. Symbolic is another possibility. Maybe there was sexual trauma, maybe relationship issues, or even someone's a pain in the butt and or something about your life is a real pain in the butt. Now you have a pain in the butt to actually pain in the neck, right? It's like, oh, there's such a pain in the neck or this or that. And you're actually getting a pain in the neck when you think or have an interaction with that person. Also, a burden. Like, I feel a burden because I have so much to carry. I need to take care of my aging father who's sick, and it's up to me, and none of my siblings are here. Like, there's so much on my back. And like, that's a possibility. Maybe you can't stomach the emotions. You're not really even digesting your feelings and you have indigestion. Throat issues. When you have no voice, or you're not being heard, or you're actually afraid to speak up out of fear for some reason. There's symbolism. Another one could be family history because you expect it genetically. Really remember, these are just examples of why the subconscious is ultimately leading to utilizing the alarm signal in a certain part of your body. You're not consciously choosing it. A past injury, you will make more sense of this, right? We don't choose physical issues that make us look crazy. It needs to be logically acceptable by you and others. Also, it's not perceived as psychological. The subconscious has a tendency to create issues that will be perceived as a real medical or physical issue. Like in the 16 to 1800s, a common response to significant stress was paralysis of a limb. And it was perceived as a medical issue. They're like, this is a medical problem. They can't move their arm now, right? And there was spinal irritation and various forms of hysteria and a lot of other psychophysiologic things that took place throughout time. But once an important diagnostic medical advance was made, which was the striking of a tendon with a reflex hammer, it was easy to discern whether this was structural, like truly neurological, or psychophysiological. And this mind body syndrome manifestation fell by the wayside because now it's like that paralysis didn't work so much, you could say, for the subconscious mind, because you could instantly show that there was nothing wrong with that part of the body or the brain. The mind can also look towards repetitive emotions. So, sitting a lot, cycling, frequent masturbation, it can create a linkage to that is why it's showing up in a certain part of the body, a certain repetitive motion with your body. Also, let's talk about energy centers as a possibility, also known as chakras. You will see a strong correlation in the energetic statements that create imbalances here. So, the root chakra, that's the pelvic floor genitals, the very base of your body. Again, this is the energy center. There's a nerve plexus, the lower mesenteric plexus inside of the body. And then the chakra is really the more subtle energy body, as it is known, which we only have so much modern contemporary medical diagnostic imaging right now. But I would definitely foresee in the future, we will be able to see at the level of energy, even before it manifests, at the more gross or dense body and the physicality. But in the root chakra, survival and sexuality are primary energetic statements that influence this part of the body. Now you might be like, yeah, I'm okay, sexually I'm fine. Survival, I mean, I make plenty of money, there's no big deal. No, but survival, you could be sending that signal that you're not okay. It's not enough. You need more. So I definitely did this a lot where I was sending the signal of no, like more growth, next level, go to the next level, higher goals. Right now, today is not enough. It's not okay. And that can also be an imbalanced aspect of that. Sexuality, inadequacy. You could feel like you're just not good enough at sex, or you're not going to bring your partner the pleasure that they want. You're feeling guilt or shame about it, maybe from religious programming or earlier in your life familially, or even lust and a very imbalanced carnal aspect here. The sacral chakra is the lower back, the bladder, lower digestive tract, that part of your body. And this has a lot to do with relationships and also pleasure. You might have a big imbalance where you work a lot, but you never have fun, or you have something really sticky going on with a family member or with your romantic partner, etc. So it has a lot to do with relationships, pleasure. Remember that your brain is protecting you from emotions or other aspects of self that you don't want to fully see. So it creates physical issues that capture your attention. Let's go over some common misperceived causes. So these can have some relevance on the body. Of course it does, right? But not in the creation of the chronicity of it, of the overall pattern and why it's staying around the neural circuit pain and dysfunction. One that's often looked at is posture or repetitive movement. So the particular alignment of your body can then create a tilt, which can create a tension, which can create a pain There are people who have really bad posture who do the exact same repetitive movements all the time that don't have pelvic floor or urinary dysfunction or even other psychophysiologic disorders. So there's not a clear, direct correlation. Does it have some relevance? Yes. If you have bad posture, it's going to inhibit the flow of energy, the flow of the breath, the flow of the blood. There are a lot of things that can enhance your life force energy, that can enhance the vitality of your body by using good posture. Sitting too much. This is one where people are like, oh, I'm sitting. I actually feel it in my pelvic floor. So they're looking for a regional location connection. It must be related to something happening down there that's creating pain down there. Again, there are people who sit a lot that don't have these issues. And then there's some people who sit that do. This is something that can create a need. You need to move your body. You need to have healthy movement. You, I'm not recommending, right, to just sit down and never move and just change your brain's neural circuitry. Absolutely move. Absolutely change to not always have repetitive movement. Absolutely eat healthy foods, right? Like we want to do things that we would do anyway, even if we weren't experiencing chronic dysfunction. Cycling. So it's thought this pressure that's being placed directly onto this part of the anatomy can lead to this dysfunction. Yes, there's pressure. Yes, is there a musculoskeletal response? Yes, can you have something, the myofascia? Can something take place here? Absolutely. That doesn't mean it has to create this extent of dysfunction, though. A past injury, we already talked about that one, but oftentimes it's thought of there's this one thing that happened in the past. That's why this is happening. Injuries heal. And also a past surgery. I had surgery in the past, so maybe something went wrong. Maybe it didn't heal the right way. Of course, you've probably already visited your surgeon or your physician, your specialist. You've looked into that. There could be a structural component, like make sure that you're okay there. But if it's a past surgery from long ago, it's essentially perceived as an injury to the body. In a way, your body heals itself. Another one is masturbation or sex. So, because I had sex for a really long time, this happened. Or because I masturbated 5 times in a day, this happened. By all means, just like if you run 10 miles or you do 500 push ups, you're going to have an acute level of soreness. You're going to have acute physiologic response. It will clear out and heal itself on its own. Even if there is some sort of damage that took place, the tissues can heal. If you get into fear around it, though, then that fear pain cycle can persist. It can turn into neural circuit pain and dysfunction, even though the initiating incident wouldn't necessarily be pathologically aligned to chronicity. Another one that's talked about a lot is food sensitivities or allergies, right? So maybe you've done food sensitivity testing, but only if you have a blood test verified allergy, a verified allergen. This could be seen as structural. Otherwise, these sensitivities can absolutely be symptoms or manifestations of mind body syndrome. Since we're talking about nutrition, let's get into that a little bit because there are lots of different perspectives on this. Remove anything that inflames you, but then we're thinking that inflammation is the cause of this neural circuit pain and dysfunction, which there is macro and there's micro inflammation. So there are different things to even look at there. People might think that it's creating a tension and a tightness because of what I'm eating. It's constipating me, etc. By all means, if you can simplify right now, do that, but in a way that's not fearful. Ultimately, we want to eat a healthy, whole foods diet. When I say whole foods, I mean the real food. Like get some broccoli. I mean, if you're eating meat or eggs or cheese, like whatever, the actual food as much as possible that's not coming from a box or from a bag. You don't have to be perfect. It's okay to eat something here and there, right? Have fun and enjoy your life. But if you're eating processed junk, you're going to fast food restaurants, it definitely has a negative effect on your body system. Again, there are lots of people that eat junk that don't have pelvic floor dysfunction. But what I'm pointing out is that we want to have healthy, balanced bodies anyway. So eat healthy, whole foods primarily. Remove excessive sugar, stimulants that you've been taking too much. and not overeating, right? That puts less toxins in your body and it gives you more energy for healing. There's literally more resources that can be put for healing instead of digestion and detoxifying, which your body's also always doing, especially if you're eating all the time. Now, I will tell you, I went through the fear of food diet. I was on the fear of food diet and I saw some changes for a period of time, but it was not curative. It was not curative. So I didn't find a direct correlation, and I have not with the clients that I've worked with, a specific food. It can help alleviate symptoms. There can be mind body syndrome, there can be placebo components to it. But if you understand how your brain creates the dysfunction and why it's happening, and you really look at those root causes, let's focus on that. Let's do that. Right. And at the same time, eat healthy foods. But yeah, because I mean, I was a vegetarian for 3 years and then I took out gluten and nuts and I took out all of these things and I took out dairy and I took it was very strict. And then I tried certain herbs and I tried certain cleanses. And I is it good to do a cleanse? Of course. Everyone would benefit, especially people who are eating this modern, like Western diet would benefit from a cleanse sometimes. It's a good thing to do. If you're doing it as a fixing activity, if you're doing it because you think that's the thing that's going to fix this, that there could be something that's misaligned there. That's what I'm saying. So, also bacterial, viral, fungal, in acute case can create symptoms. So if you actually have prostatitis, epididymitis, you've got a UTI going on right now, yeah, I mean, take antibiotics or follow the course of action, let it clear out. Something fungal, you might need to take some sort of course of action again. But also know this that an imbalanced mental emotional state, your inner environment ultimately, creates an environment in which pathogens can grow and flourish, not purely because of what you're consuming. These pathogens are opportunistic. Are you creating an environment of opportunity for them to grow and flourish? Otherwise, they're going to come in and out sometimes. There's bacteria, viruses, there are fungi. I mean, parasites, it's a part of being alive. Like this thing that looks like a body is just made up of a bunch of cells. And this entire network, this biome inside of us, it's amazing. So don't be afraid of them, but have a balanced mental, emotional state and support it with a healthy, wholesome diet and joyful movement. So now let's look at some root causes to consider root causes that actually lead to that nervous system dysregulation, the brain potentially creating and activating due to these danger signals. Like what danger signals could be going on within you? The first one is current life stress. I mean, the stressors of your current life. Maybe you're overloaded, you're overwhelmed. Maybe there's just a lot going on. Sometimes that happens. Sometimes it all comes on at once. Maybe there's fear around an injury, something that happened with your penis or your testicle or your some part of this region of your body, I would imagine, and you're fearful that it hasn't gotten better, that it won't get better. And that fear, of course, activates that pain fear cycle. It ultimately enhances and amplifies this entire situation and propagates the neural circuit disorder. Are you engaging in high alert behaviors, such as technology use that is super imbalanced? I mean, picking up your phone throughout the day so many times, checking, getting distracted, and notifications and social media and checking your email 20 times a day. Most people do this literally all the time. These are high alert behaviors. When you're like always thinking, you're always on, you're expecting, you're anxious, you're getting dopamine hits. That's not a very balanced way to live. Notice it. Are you constantly distracted where you can't even sit down and just stare at the wall for a few minutes? Can you do that? If there's constant distraction, there's a reason why. There's something deeper inside of you that doesn't feel that good when you sit with it. So it feels better to distract yourself and to give your mind something to look at, to think about, to experience. What about porn? masturbation used as a coping mechanism, not as a form of pleasure and enjoyment. There's nothing wrong with that. But if you're using it as an outlet instead of recognizing how you're really feeling or other addictions, you could be leaning in to something else, right? But these high alert behaviors are absolutely adding to the pot. Another root cause to look at is personality tendencies. And I like to talk about the type T personality, which means type tension. You can find this in some other books as well. It's so crazy, but I would say I think all of my clients, or at least almost all of them, have this personality type. What do you see within this personality type? Being hyper responsible, being an achiever, being someone you can count on, someone who oftentimes also fears confrontation or really speaking up and ruffling feathers. Someone who might walk around on eggshells around others or be a people pleaser, and someone who is perfectionistic with very high standards for themselves, puts a lot of pressure and is more self critical and self judgmental. There are some other aspects of this personality type, but noticing within yourself your own personality tendencies, we don't have to label you or say you're a type T. That's not the point because I was a type T. I had these personality tendencies. I had that archetype and I've had to change. The pain forced me to change essentially. But now life is so much more relaxed. I've created more balance. I still have organization and discipline and the ability to focus. But I also allow myself to have more flexibility and fluidity and to have fun and to not make life so serious and not make life just about the future. I was very future focused. It was about how can I get better? How can I improve? How can tomorrow's going to be great. It's going to be better than today. So I was making the now moment, ultimately the present moment to a means to an end and had some other things going on. I definitely feared confrontation. I was quiet and I had to learn that through some relationship situations. But what's so interesting is that I've never met someone who is lackadaisical and just surfing every day, floating around through life, not someone who you can count on at all, someone who can't hold a job, that has pelvic floor dysfunction or these issues. It's very interesting to me. And I don't have a lot of clients who are really extroverted and aggressively expressive with their anger or the way in which they kind of control others. People who do that tend to have heart issues and blood pressure issues. And you can find different physical body maladies that show up with the personality type tendency, which, if you actually study the way the mind body emotion complex works, it completely checks out. It makes sense. But if you're looking at it through allopathic medicine, you're like, oh, that's just psychological mumbo jumbo. But for almost all of my clients to have a very similar range of personality traits is very, very interesting and compelling to me. The point is noticing that these tendencies, as we talked about in an earlier episode, were actually created as coping mechanisms. They were created to help you to survive, and you don't actually have to have them any longer. There's a part of you, though, that's not going to like hearing this. You're like, no, 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 no. If I let go of being hyper focused and achievement oriented and always being hypercritical, I'm not going to succeed any longer. That's helped me to be financially wealthy, or it's helped me to succeed in my career, or it's helped me to be a great athlete, etc. By all means, you're actually going to have more energy for creation. You're going to have more energy in the present moment for that which you're doing because you're all here. I am all about, dreaming and envisioning and moving things forward. I only have more energy now to serve and to impact than before because there's less junk going on in my mind. There are less fingers being pointed at myself. It's really amazing. So I just want to point that out, that these personality tendencies are stress inducing and they create danger signals. Repressed emotions. So this is where you had a situation in which an An emotional wave was created, but it didn't pass all the way through you. You didn't allow it to because it was so painful. It was so hard to deal with, and you wanted to push it away and move on with your life. You're like, no, no, no. I just got to keep going. I need to get back to work. I'm not. It's too hard. I can't feel that sadness, that grief, that anger. That it doesn't make any sense. Why can I be angry? I shouldn't be angry at my own mom. Like then you feel guilty about it, and you have a lot of things that can be repressed over time. So these repressed emotions are energy and motion that are patterns within you that actually sensitize the brain over time whenever they are present. So, if they have not yet been released, they are a major component of that which can create neural circuit pain and dysfunction and ACEs, adverse childhood experiences. So, in your childhood, did you experience physical abuse, sexual abuse, emotional abuse? Did you live with someone who abused alcohol or drugs? Were you exposed to domestic violence? Did you live with someone who had gone to prison? Did you live with someone with a serious mental illness? Did you lose a parent through divorce or death or abandonment? These are very difficult, trying, traumatic moments in time for a child, and they can create a fear response. They can sensitize you and make you more susceptible to future life triggers. So, noticing if you went through something like that earlier in your life. And what about psychological conflicts where two things are conflicting inside of you? And it's in the subconscious, so you may not be as aware of it as you think. What about disliking your job intensely, but fearing the threat of unemployment or not being able to provide for your family if you quit? So inside, it's like, there's like a damned if I do, damned if I don't sort of feeling. An aversion to your mother mistreating you, because you clearly don't like the way she's been treating you, but you also love her and you want to spend time with her. Maybe you are gay, but you're afraid to tell your family because of their religious perspective on sexuality. Maybe you've always wanted to have kids and raise a family and you love your current partner, but your current partner doesn't want to have kids at all. So these conflicts can be deep within. And if you're not listening to them, if you're not listening to the message of a change being needed, or at least to express the emotions, because sometimes we may just be quote unquote stuck with what is right now, right? And we need to surrender and recognize that, but actually feel it and notice it versus hiding from it. Now that we've gone over what mind body syndrome is, or you could call it neural circuit pain, neural circuit dysfunction, how this is all working, and we talked about some of the possible root causes at play for you. In the next episode, I'm actually going to guide you through an assessment so you can better understand what is at play in your case. Now, I made a self assessment and root cause discovery workbook. Definitely download it now or download it before you do the next episode. Do it along as you're listening to the episode. You can do the workbook or you can do it on its own. But the point is, it's really, really helpful because it lets you see, okay, am I dealing with mind body syndrome? Is there something structural here? And then what are my root causes? Like, why is this even happening inside myself? So go ahead and download that. It's in the show notes. And I look forward to seeing you in the next episode.